All right, on this video, we're actually going to talk a little bit more about a restorative case and how we would approach this. And this patient is in the process of being restored. And one of the questions we had is, what do we do with these front four teeth that she had crowns many years ago and wants them revamped? Now, this is not a true TMJ case. You know, if you've been watching this channel, we talk a lot about TMJ, a lot about TMD. This is more just a simple restorative case where I want patients to kind of realize that it's not just the front four teeth. It's not just the top teeth. It's how the teeth function together and how do we get the best aesthetic result. And what we're going to see when we actually smile. And obviously, we're a little bit limited on how we do these videos because we're only looking at the scan right now. And I'm going to start to add, photos as we go along as well. But it shows the purpose of what it is that I'm trying to explain to patients in a way that, you can be thinking about this if you're thinking about doing any type of cosmetic dentistry, whether it's crowns, veneers, cosmetic bonding. I want you to be thinking about, which teeth are we doing, but which teeth need to be done in addition to the teeth that you want to do to make the smile look as good as possible and to function as well as possible, okay? So this is a great example of a patient that had four crowns when they were younger. Wants the crowns to look better. We have better materials now. We're looking at this tooth, this tooth, this tooth, and this tooth. Is it the worst I've ever seen? Absolutely not. Could it be better? Absolutely. We just have great materials now that we can use to make these teeth look better. Now, the issue in this case involves the bottom teeth in addition to the top teeth. What we don't understand is as we get older, our lips actually start to move downward with gravity, just like everything else. And we actually start to show a little bit more of our bottom teeth. And so aesthetically, we don't want our eyes to go towards teeth that were redone and then notice that the bottom teeth are in malalignment and crowded. So I want to pull back the veil just a little bit here and talk about two things that I think need to be done in this case to get the best possible aesthetic and functional result for this patient. If we were only worried about these front four crowns being replaced, what would we do and how would we do it? Okay. First thing I'm going to point out is these lower teeth. Okay. Now, this guy right here, okay, you're going to see that tooth is her lower right incisor. This is her canine tooth, the tooth next to it, and all of these teeth really have some malalignment here. This is very typical if patients had orthodontics or braces when they were younger, they stopped wearing their retainers, and teeth want to move back where they were originally. And so that's actually what happened here, where the teeth move back and they start to tilt back. Okay, and as they tilt, a couple things happen. This guy and this canine tooth and this guy right here, they actually start to close. They close the space. They're like blinds that are being closed around the window. And this tooth right here, the one in the middle that's malaligned, is going to continue to move back. And you get to a certain point where it's actually very difficult to move this tooth where it needs to be without either taking teeth out or really heavily reducing the teeth next to it so that tooth has space to be able to move back in where it's supposed to go. So the first thing I noticed with this case is, yes, we want to take care of the front four teeth on the top, but we really should also be looking at the bottom teeth and the alignment of the bottom teeth so that when your teeth in the front look perfect, when you're smiling and you're talking, patients aren't going to noticeably, their eyes are going to be drawn to that malaligned tooth in the bottom. Okay, it's a very commonly overlooked thing. Hey, I want 6 veneers on the top. I only smile with my top teeth. Nobody's going to notice my bottom teeth anyway. I can tell you, people do notice it. They may not necessarily point it out, but people notice it, and their eyes are going to be drawn to certain malalignments of the teeth, especially when everything else is perfect. Okay, so that's the first thing that we notice, is that just from an alignment standpoint, we would always want to start with Invisalign in this case, just to make sure everything is perfect from a aesthetic standpoint on the bottom teeth, without necessarily crowning or veneering or cosmetic bonding the bottom teeth, which we could do. But in this case, I don't think that that's necessary. I think you could do some Invisalign, you get them straight, aligned, and then if we want to do some whitening, we can do that as well. And here's the other reason that we want to look at these bottom teeth. Okay. If we look at the top teeth now, and we put the top teeth back in, and we look at the bite analysis for this patient, and I take the bottom teeth away, and now I'm going to rotate. So what I'm going to do is this guy right here, this is one of the incisors that's going to get the replacement. This guy is the right side, and you move over to the left side because I'm flipping the teeth around, right? look at what happens to the bite on certain teeth, okay? So this crown gets a bite right here and then a little bit right here. This corresponds to the tooth that's pushed back. So that tooth is actually going to be hitting right here, okay? Then you have a heavier bite on this tooth, and then a lighter bite on this tooth, and then a lighter bite on this tooth, but then a really heavy spot on a touching at the edge of that incisor. So we have bite imbalances here. They're not hitting at the same time, and they're not hitting in similar intensities. So what that means is that as this patient grows older, the chances of this tooth and this crown chipping and this tooth having issues goes up dramatically because they're hitting heavier than the other teeth. Okay? And then you also have the issue that this tooth is going to also have potential problems because it's being hit in a weird way for a tooth, because this guy down here is tilted back so far that it just is a very odd bite for this patient. You'll also notice that the teeth that were corresponding to the heavy contacts are right here on the bottom and over here on this canine tooth. So what does that mean? It means a couple things. The crowns that we need to be replaced, the crowns that need to be replaced, and we're going to be replacing the crowns, ideally I'd want to put them in a better bite environment so that the crowns last longer. If I put them in a bad bite environment, those crowns are not going to last as long. Or we might have to change the material and do something maybe a little bit less aesthetic, but a little bit stronger so that the crowns hold up better. Okay. The other thing is when bites are kind of imbalanced, then you'll see more malalignment of the teeth over time, not less. So you'll actually see these lower teeth move in more weird positions as we get older, because now the bite forces are more on one and not as much on the other one. So this one's going to move more than this one. You start to see a lot of teeth that get a little bit wonky over time, especially if we don't address it with Invisalign before we start. So let's go back to the question of which teeth are we working on here and what do we want to work on, okay? If the patient unequivocally told me 100% I only want to do the front 4 teeth, I'm only replacing the crowns, that's all I'm going to do. Okay, that's fine. Just understand that there's limitations. I'm going to take this away. There's limitations in terms of the aesthetics that we can get for this case, because I have to either put a different material in there. It's going to be a little bit more resistant to chipping or breaking. Or if I put the material I want to put in there, there's a chance that it's going to break and chip in the future. And that's out of my hands because I can't control the bite that I'm putting these crowns into. Okay. If the patient said, okay, I understand that, now I want to do something a little bit different. We don't want to start to adjust the whole bite. We don't want to be doing cosmetic bonding or veneers on the bottom. What can we do? Now we want to sequence it by aligning the teeth first with something like Invisalign. Okay. Then once the teeth are in the best position possible, and I'm talking bottom teeth and top teeth, we do everything together. They're puzzle pieces. They have to fit together. And I can create the bite that I want to create if I know I'm going to be putting new crowns into this mouth in the front. And so now that everything is aligned, everything is balanced, the bite looks good, I can go ahead and whiten the teeth that I need to whiten, the bottom teeth, the premolars. Then I can go to the crowns on the front, replacing the crowns. I know now I have a good bite environment. I know now I got the shade of the rest of the teeth where I want them. Now we can, make these teeth look more natural, more beautiful than what she currently has. Again, it's just something to think about if you are thinking about doing veneers or crowns or any type of cosmetic dentistry. The tendency for most people really is to just focus on the teeth they want fixed. I want my front 6 teeth fixed. And I don't really care what the bottom teeth look like. No one's going to see it. You actually see them more than you believe you do. And you want to make sure that if you're going to go through the top teeth, you might as well get everything balanced, the bite aligned, the teeth looking better, wear your retainers. But then once everything is straight and aligned, now we can go back and think about replacing the crowns that we want to replace. And we're going to get a much better aesthetic result, and we're also going to get a much better functional result. So hopefully you got value from this video. As always, if you have a question about anything TMJ, TMD related, cosmetic related, and you're looking for some help, I can't necessarily make a diagnosis over YouTube, but we can always invite you into our office here in Fort Washington, Pennsylvania. If you're traveling from abroad, we do see patients from out of state as well, so that's not the end of the world. We can figure out how to make that happen for you if this is something that you're interested in doing. So if you want straighter teeth, better looking teeth, more functional teeth, teeth that don't create pain, then I highly encourage you to reach out to us, or you can go to our website, and we'd love to see you as a patient. So with that being said, guys, thanks so much for tuning in, and I'll see you at the next video.